Good morning, everyone. Welcome to our second day of the Utah Healthcare Association's virtual conference. Thank you to our sponsors, BKD, and to our presenters today from Comagine Health. We have Patricia Polina with us, as well as Shannon assisting her. And just a little bit about Patty Polina is a family practice nurse practitioner with advanced certification in hospice and palliative care. She's worked in multiple settings and currently for the Admissions Transitions Optimization Program. And it is a payment reform project for the Center for Medicare Services. The ATOP program focuses mainly on the reduction of avoidable hospitalization in nursing facilities. She also continues her work in the field of hospice and palliative care as a clinician, an active board member of Nevada Pulse, and with the Nevada Advisory Council for Palliative Care and Quality of Life. Welcome, welcome. We're so glad you're joining us. And just a reminder that we will be giving away 2 gift cards. And I'll go ahead and turn the time over to you guys.
Okay, thank you so much, Andrea. Good morning, everyone, and welcome to our presentation today on appropriate PPE use for assisted living homes. This is actually part of the overall infection prevention collaborative that Comagine Health is running in collaboration with the Utah Department of Health. I want to take a moment to just thank the Healthcare Association for having us as a presenter here today, and thank our panelists joining us today, Dr. Alan Nakashima and also Christy Grimes with the state survey folks. So I put in chat, if you all wouldn't mind, please letting us know who is here with us today. We love to just have a sense of who's in the room. And so if we could go to the next slide really quickly. Okay, just wanted to kind of give you, before we get started, a little brief review of some of your controls in Zoom. If you're not familiar with the platform, you should be able to see the presentation directly on your monitor. And the camera and microphone icons on the bottom left will allow you to share your video and also to speak. During the presentation, both will be off. We do encourage you to enter comments and questions into chat, and to do so, there is a button on the middle bottom of the screen. If you're using a phone for your audio, when the time comes, we will be able to have you mute and unmute by hitting *6 on your phone keypad. And also, if you're using audio for your phone, we ask that you link your phone and computer through the directions on the screen. So, next slide. Just to give you a little background about Comagine Health, we are the Medicare Quality Innovation Network Quality Improvement Organization working in a 6-state region of Idaho, Nevada, New Mexico, Oregon, Utah, and Washington. And our basic mission is to help our providers across the spectrum to really help deliver better care at a reduced cost. And so we worked with a variety of settings, and we're really delighted to be able to bring infection prevention to both assisted living and intermediate care homes, and hope you're finding these sessions valuable. Next slide. This, as I mentioned, is part of a learning series that we've been doing. We're now actually on the 4th session. And essentially what we're trying to accomplish is making sure you get the training and materials on essential infection prevention and appropriate PPE use, and having it tailored specifically to the needs of your particular setting. And also why we're doing this is to make sure that we are providing you support during your COVID-19 pandemic preparedness and help you to address gaps and needs in your building. And essentially, one of the best reasons for a collaborative is that we all do better when we're learning and growing together. So, next slide. What we are committed to do for you is make sure we have the most relevant information, that we are giving you up-to-date guidelines, providing good content, providing a platform for peer-to-peer sharing, inviting our state partners to tell you what's happening on the ground and answer your questions on the local level as well of regulatory and infection-related questions. And we are committed to listening to you and remaining flexible on content, and always love your suggestions for where we could do better. And what we're asking of you is, of course, to come to these sessions. use chat to ask questions. And as you're chatting in, there's an option to select panelists and attendees. And I'm going to invite you to select that so that you can make sure that your fellow attendees can see your responses as well. And given the opportunity for Q&A, ask questions, please. Share your challenges and experiences. We're all learning together. We'll be doing in a few weeks a mid-series check-in to just see, again, are we hitting the mark? Are there things we could be doing better or differently? And we do give you a little something to try to work on each session, so make your best effort to try to do those. Next slide. So as I mentioned, we've had 3 sessions before. If you're joining us for the first time today, I'm going to invite you to put your name and email into chat to me so that I can make sure that we're sending you the recordings of the previous sessions and get you on our list for our next session that will be happening next week. So far, we've had a kickoff. We've talked about basics of controlling respiratory outbreaks, management of individuals with suspected or confirmed COVID-19, and today we'll be talking about personal protective equipment. So, next session. Okay, so we have a polling question for you, and I'm going to ask Andrea if she can pop the first one up. This is one of 2. So this is just testing your knowledge. Again, this is anonymous. We're not going to know who sent this, but please let us know what is your best guess for the correct order for PPE removal. And you have a choice of gown, gloves, eye protection, and mask in varying orders. So just go ahead and make a guess. And we will cover this during the session, so by the end you'll know. And we'll give you a couple more seconds to be able to do that. Okay. So, Andrea, can we pull up the responses? There we go. Okay, so 53% of you said A, 26% went with B, 5% went with C, and 16% went with D. So I'll leave you in suspense and let Patty answer that question for you in a few minutes. And we've got one more poll coming up.
Sorry, Shannon, you know, I may have misunderstood. I think I've got the second polls in the later.
Oh, so let's see. Lisa, would you do me a favor? Would you please put the poll question into chat if you can?
I don't have access to copy
Oh.
it since I'm sharing my screen.
Okay, you know what? Then we'll skip that one and we'll actually just go into our.
Shannon, is it the N95 one? I can bring that up.
Yes. Mm-hmm.
Okay. I'm sorry about that.
Well, that's okay. Hang with us for just a. Oh,
okay.
There we go.
There you go. Okay.
Thank you so much. So when is it most important to wear an N95 respirator mask? And so A is when caring for a COVID-19 positive resident. B, when transferring a COVID-19 positive resident. C, when performing an aerosol generating procedure. And D, when collecting a COVID-19 sample. So again, make your best guess, and Patty will be addressing that during the presentation. I'll give you a few seconds. Okay, so when those responses are ready, Andrea and Ali, if you could bring up the response so we can all see. Okay, so we had about 43% of you going with A, 0 with B, 57% with C. So again, we'll leave you in suspense, and I will turn things over to Patty to start our presentation. So next slide. All right. So Patty, I'm going to turn things over to you.
Okay, thank you. Good morning, Utah, my fly fishing paradise, although not during the pandemic. Next slide, please. A beautiful state. So we're going to talk about appropriate use of PPE, when to use, putting it on correctly, taking it off correctly. We're going to talk about staff education priorities, and also auditing correct use of PPE and giving feedback in order to remind everybody and keep them doing it correctly. Next slide, please. And let's see. So these are the PPE recommendations for COVID-19 evaluation and management. And I'm going to try and get rid of my little screen there so I don't see myself. Okay. So there are some variations on the resident situation. Direct care workers, very important that they have the correct PPE so they don't infect themselves or others. Is there a private room? Are you cohorting patients? And then outside of the room, you don't want infection to come into your facility because it's so difficult to get out once you get it in. And so there are techniques for that, protocols for that, although I think that this presentation focuses much more on PPE within a facility or intermediate care home. Next slide, please. So this slide has some very important links, and these are what we're going to focus on for PPE, personal protective equipment, conventional capacity. Hopefully everything that's recommended should be done during conventional capacity. Contingency capacity, we want to plan to make sure that we have enough PPE. And these links here, the top link is for a burn calculator, which is very useful. You may already be aware of it, and you could download this calculator. It's a phone app as well. So I got it off the Apple Store, and I'm sure you can get it for non-Apple phones. Crisis capacity or strategies that can be used when you can't meet the current need if you have some kind of a surge. So the burn calculator is to help us avoid the crisis capacity. I know we can't control everything, but it is to help us to plan the very best we can to have enough PPE in place and have an idea about how much we're going to need ongoing. And the lower link is very useful. It's a CDC link, and it's basically a summary of strategies to optimize the supply of PPE, and it's got all kinds of additional links which are really useful. And so I would highly recommend checking those links out. Next slide, please. This PPE grid is from the Utah Health Department, which is very useful, and it has some really good information on that website through these links. When you go in from Google, you kind of have to dig around. These links are a little bit more direct. That particular link has some great information on helping preventing infection from visitors coming in, because ideally you do want your patients to have some kind of visitation if it is allowed, depending on what's currently going on in the state and in your facility. But there's a lot of precautions involved. And it has the basics that the CDC website talks about in a nice grid for conventional contingency and crisis, follows all of the PPEs, and for all of the eye protection gowns, gloves, face masks, N95 respirators, and other types of face masks. Next slide, please. And these are a few terms. Reuse would be removing and disinfecting as appropriate PPE for future use. And I would think as far as disinfecting, we would be thinking about face masks. I don't think that we have, that I'm aware of in Utah, a good way of disinfecting masks. Extended use, which is preferred, because when you're taking and putting on things and taking them off, there is more risk to contaminate yourself and contaminate others. So in some situations, you would be using the same N95 mask for an extended period. You also need some kind of eye protection. If you're going to need an N95 mask, you're going to use eye protection. I would favor a face shield personally, but goggles can also be used for multiple resident encounters without touching, removing, or disinfecting. And then, as we know, the N95, it's a mask that at times has been hard to get. The CDC website actually has a list of acceptable masks from other countries. This would be like in a crisis, desperate situation, but it gives information about which ones could give you enough protection, like an N95 mask. I thought that was interesting. N95 masks should be used for aerosol generating procedures. And I had a chat with Martha Jaworski, who prepared much of these slides. And we were talking about nebulizers, and I think that would be one of the things you would encounter more frequently in your facilities. Also, perhaps some types of trach care. Also, CPAPs and BiPAPs could be aerosol producing. And so that's when an N95 mask would be important to have, especially if you have patients that have symptoms or positive for COVID-19. Or other diseases, don't forget TB and other, which would be another reason. Next slide, please. General glove use. Yes, and just in mentioning that, COVID-19 isn't the only reason that we use PPE. There's chickenpox, measles, which we may encounter less. I don't know about in Utah. Clostridioides difficile is contact, and so that is where gloves are very important, and gowns. So we use gloves as a barrier. The basics are work clean to dirty, do not touch your face, avoid touching environmental surfaces as much as possible. Change your gloves when moving dirty to clean within a resident encounter and after each resident use. Be very mindful when you are wearing gloves. I know that gloves and surgical masks are required in Utah facilities. Keep very mindful about what you're touching and where you're going wearing those gloves. Next slide, please. So this is glove use in a crisis. The best practice is to use gloves for single resident only, use in isolation rooms, risk of blood or body fluid exposure, and you perform hand hygiene after glove removal and before putting on gloves. And that's always the case. In a crisis, and this information is listed on the CDC website, gloves can be sanitized with ABHR between procedures on a single resident or between residents within a cohort. Say if 2 residents are in a room and they may have the same condition, that would be only in a crisis. And that's only if the gloves are not noticeably soiled. If you are in a crisis using non-healthcare glove alternatives, those may not be those cannot be sanitized with ABHR. And then don't contaminate your hands when removing gloves. I had another thought about that. Oh, yes. In terms of C. diff, Clostridioides difficile, ABHR is not effective against that. So in that case, I would not be counting on sanitizing your gloves with that. You would be washing your hands after glove use with soap and water. Next slide, please. So this is for isolation gowns in a crisis. If you have washable gowns, that would impact laundry. It depends on what kind of a laundry operation you have. The correct practice is one gown, dispose of the gown after use. If it's necessary for extended use, it would be a gown for more than one resident with the same condition. So you would be keeping it on in the same location. It's good for time management and also for infection control to cluster your tasks. And so organize your time to do, say, your morning care, your personal care, toileting, changing linens. Do as much as you can in one sitting to minimize gown use or help save gowns. And this is a tricky one. Consider not using gowns for endemic multi-drug resistant isolation during COVID-19 pandemic response. That one's a little scary to me. I guess it depends on the crisis situation. And whether it's endemic, your health department actually would have the best up-to-date information on that. CDC has a list of gown alternatives. CDC doesn't give any recommendations on reusing disposable gowns. And the CDC has some guidance on possible reuse of cloth isolation gowns. The front and the sleeves of the gown are always considered dirty, so keep mindful of that. Don't be touching that area. Next slide, please. So eye protection in a crisis, it is possible to get infected through your eyes if droplets somehow land in your eyes or if you're performing an aerosolized procedure. With all of these pieces of PPE, you can't, in a crisis, or if you can't get it, you can use beyond the expiration date. It's most important to have it. You can use it for extended use and leave it on your face. And it can be disinfected between uses. And we do have some guidance on that. Actually, the eye protection may have some guidance on how to disinfect it. But if it doesn't, make sure that your facility has a process for it that everyone follows. So you would be having a clean area to disinfect. You would be performing hand hygiene and glove up. You would disinfect the surface that you're doing this on. You would remove the goggles and disinfect the inside and then the outside. And for the outside, they recommend an EPA hospital disinfectant solution that would kill the virus, that would be rated to kill the virus. But you would clean the inside first with whatever you have available, wipes or some neutral detergent. And then if you get streaking on the front, and I know some healthcare facilities have little tricks for that, but you can clean it with water or alcohol to move any residue if people are having trouble seeing outside their mask. And then if you're storing masks, have a specific place to store masks. And one person should be using that mask, that mask throughout their shift. They shouldn't be shared. Next slide, please. non-N95 masks, ideally those are surgical masks, and that's what it says in the Utah Department of Health as well. Procedure masks aren't quite as protective. So you'd be using a face mask and of course your gloves. In a crisis, you can use it for multiple residents. You don't want to touch your face. And as mentioned throughout the recommendations, don't hang your mask or your goggles. Don't hang it around your neck ever. You can contaminate, you can get it infected and contaminate yourself, or you can contaminate others. So be very mindful of where things are, where PPE is on your body. You can store the mask folded, they say, with the outside contaminated sides together in a sealable and breathable paper bag. And that's so you keep track of what side you're putting against your face. That's very important, actually. There was a big outbreak in a facility in Nevada that did not do that, and there were a lot of deaths. Priorities are surgeries, procedures, anticipated splashes and sprays, and prolonged face-to-face contact. If you don't have any mask, and this is a desperate situation, use a face shield. You know, cover your face with something, engineering controls or physical barriers. For the mask and for the eye protection, handle the ties or the elastics only. Next slide, please. So general use of N95 respirators, you should have fit tests for these. It's normally done when you healthcare personnel are hired, and then it's done yearly. Someone in the facility needs to have training how to do that properly. In crisis situations, that may be suspended for a period of time. Also, if you keep changing types of respirators due to supply difficulties, when you put on an N95 respirator, you want to do a fit check with your hands, your clean hands, or your gloved hands if you've been using the N95 respirator, clean gloves, to make sure that there's no air able to come in outside through the respirator. So this is for airborne isolation. The reason we do it with COVID-19 is we believe there is some airborne transmission. Also for TB, measles, and chickenpox. And then again, some of these other diseases such as measles and chickenpox have contact precautions as well, but those should be within your policies. And used for aerosol generating procedures, as I mentioned before, such as nebulizer treatments. Next slide, please. Use in a crisis. So perform a user seal check when donning. Keep in mind if you're reusing, though, don't use clean gloves. Yeah, fit test can be hard, and that's really true. So there are situations, I saw that in chat, where you may have to suspend testing during a crisis. So yes, we understand that, and I think the CDC understands that as well, because they do mention that. So, and also, I guess, reinforce instruction to encourage proper seals with the different masks that you use. You can use beyond shelf life carefully. As we say here, yeah, the requirement may be suspended in a crisis. And a person may wear the same N95 respirator in extended use. Ideally, it would be covered with a face shield. That would be my preference. Don't allow the mask to hang around your neck. Don't touch the front, as we said before. The consensus is to not reuse the respirator after an aerosol generating procedure if contaminated or if user seal check fails. Next slide, please. So if you are able to do fit testing, like I said, you should be doing it if you are able to, but we understand there's situations where that is a problem. You should have a trained fit tester. It is part of a respiratory protection program. And that's something that you could probably look up on CDC and OSHA. There's probably a link to OSHA on CDC. I'm pretty sure there is. Next slide, please. So other considerations for PPE use. Have processes, consistent processes for where PPE is being put on, where it's being taken off. And, you know, if you're doing some kind of disinfecting, there should be areas for that, specific areas for storage. You normally put your PPE on outside of the room, and then you remove most of your PPE inside the room, except your face mask and respirator. And so you would be removing that immediately prior to leaving the room or outside of the room. And there should be receptacles consistently available for where that's going to happen. There needs to be a plan, so everyone does it the same way. Make sure that the receptacles are there. Those receptacles tend to fill up sometimes, so be mindful of that. And then have, as I mentioned before, have processes for cleaning and disinfecting, and it depends what your layout is and where you would do that, but you want that all to be consistent so everybody does it the same way. Next slide, please. So these, and you've probably seen these are available on the CD site, and they are really handy. You can put them around as reminders. If you have a staff member or someone that hasn't been recently putting it on, it's just a great reminder. So the sequence, and I think most people got this correct, is for putting it on and taking it off. For putting it on, you're going to put on your gown first, then your mask, then your goggles, and then your gloves. Now, if you're wearing the same mask and goggles for multiple patients, then that step you would be eliminating. You would be putting on your gown and then going to your gloves. You'd be washing your hands before you put on your gloves. Well, before you start putting on your hygiene, everything, before you start putting on your gown. Next slide, please. And then think dirty to clean when you're removing it. Your gloves are your dirtiest, and think clean to clean, dirty to dirty. There's a illustration there about how to remove gloves, that you're touching the dirty areas and then you're kind of rolling the dirty areas inside. And then you're holding them from the clean area when you're throwing them away. Goggles, make sure that you're touching the elastic or straps on the back to change. The gown, remember that the front and the sleeves of the gown are dirty. And so you are turning it inside out, so the dirty sides are inside before you dispose of it. And then the mask or respirator is the last to be taken off. Make sure you're touching the back and that you're washing your hands or cleaning them with alcohol-based hand sanitizer at the end. Next slide, please. And this is an alternative way to remove gown and gloves, because when you do put on your gown and then your gloves, ideally the gloves will cover the gown. Sometimes I've not been able to achieve that when I've been putting on PPE. It just depends on the fit and the type of gloves. But if the gloves fit over the gown, that is a way to do it where you can remove the gown and the gloves at the same time and then roll the dirty area inward. And then you would be removing your face shield and then your mask and respirator and then cleaning your hands. Next slide, please. And this is just a reminder of what's clean and what's contaminated. So as we said, the outside of the gloves are contaminated. Think about where what you're touching with your gloves. The gown, the outer front and sleeves, the eye protection, the outside and the front, and the face mask and respirators, the outer front. Next slide, please. And this is a group of links to get information on PPE supply. Don't forget about the burn rate calculator. There's a link to that again here. Next slide, please. And another important aspect is staff education. And that's just an ongoing thing. Have your policies be consistent. The posters are a huge help. There's a link to a bunch of great videos here from the CDC, or you can actually even look up the CDC videos on YouTube, I believe. But there is a link here on the slide deck. And return demonstrations are important. You want to observe people. There's a lot of things that people do unconsciously, and I know I do telehealth visits, and one thing I see frequently, and people don't realize they're doing it, is they start pulling on the front of their masks. So they may need reminders, especially, well, people have been using masks for a while, but people need reminders basically. Don't touch the front, don't put it down around your neck, don't pull it below your nose. And plus, all the rest of the PPE is important to observe how they put it on and take it off. And so then give positive reinforcement and constructive criticism to help them be consistent. Next slide. So related policies, this is, there's information on all of these things on the CDC website, standard and transmission-based precautions, respiratory or contact, droplet, have mandatory eye protection. I don't know about contact with mandatory eye protection. That's an interesting question. You may want to refer to the website and verify that. Standard precautions is for anybody all the time. Hand washing, gloves when touching any kind of body fluids or doing any kind of personal care. Contact is for contamination such as Clostridioides difficile. And droplet precautions are for pneumonia. Those are just some examples. Hand hygiene is primary in all of these precautions. And there are updates too. So periodically look at your Utah Department of Health and the CDC website. They do, because I've been going back to this website all the time, and they have additional information all the time. Next slide, please. And this is another picture of the posters that you can download and you can laminate if you want them. And then you could add additional procedures that you have in your facility in the same area, so that everything would be in one place, or have it in several places where people can easily see it. Next slide, please. This is a link to the YouTube videos for PPE from the CDC, and they're short and they're easy to watch and really helpful. Some people learn better with videos, some people learn better other ways, but the videos they're very good. I've looked at them. Next slide, please. Yes, as we know, the state of Utah requires use of gloves and surgical masks for all resident encounters. And at a minimum, when a healthcare worker or a visitor enters a patient room or has direct contact with a patient for any reason, he or she should wear a surgical mask and gloves. Next slide, please. Again, return demonstration, we perform with staff as they're using PPE during the day. It's a good idea to walk around and just kind of monitor. I think that that's a good way when people don't expect it. Use an audit tool, which we'll see in a minute, and then provide feedback and review steps as necessary. Try to make it positive rather than punitive, but it is, you want to emphasize the importance. Next slide, please. Okay, we're still talking about audits. Audit the staff. Is it being used in the right situations, which you can quiz them on. You could do little quizzes. Order of putting on and removal, technique. Is hand hygiene performed as needed during donning and doffing processes? And hand hygiene is a huge one. Everyone's is busy. They have a lot of patients to tend to, but that hand hygiene is so important to do correctly. Next slide, please. There we go, the audit tool, what I've been waiting for. So this is one tool that you can use, and you can use it per healthcare worker. It includes, CNAs up to the docs. The docs, you need to watch them too, they forget. And then there's a way to, you can check their use of every single, it's just a great reminder to check everything. Did they use the right things? Did they put it on correctly? Did they remove it correctly? And then you can use that as, what do I need to do a extra presentation on? What do I need to reinforce? Next slide, please. And here's some resources. The posters again, the YouTube videos, PPE contact list. Yeah, I Googled the Utah Health Department because I used the links first, which are really direct. When you just go to the health department, you kind of have to dig a little bit to get to what you want for infection control, but it is there. And then the audit tool and PPE policies. And if you don't have policies, I'm sure that either your health department or other facilities can help you with models for how they do it. Next slide, please. So confirm your policies are aligned with current recommendations. I would think that that when in doubt, your Utah State Health Department would be the prime authority. Use your videos, audit your staff. For quality control, compile your data so you can identify specific needs for further training. Next slide, please. And polling questions. And I can't remember if I answered the question. Oh, yes, about the one about using the N95 masks. I agree with most of the answers that I saw. I think they picked A and C. I would still use an N95 mask if I'm caring for someone with that's positive for COVID-19. One of my colleagues and I said that we would have used an N95 mask for all of those instances. I'm not sure if there's a next slide or not. Is there?
So actually, can Andrea or Allison bring up, we'll just kind of see what you gleaned from this presentation today. We're going to give you the same 2 polling questions and see if you had any changes in your answers or gotten any new pieces of information from today. So we've got those same 2 slides. So again, choose the correct order based on what you heard Patty share today. We'll give a few more seconds for you to respond if you haven't yet. And Andrea or Allie, when that populates, if you could show us. Okay, how'd they do, Patty?
63%, you would, for removing it, you would be taking your mask off. Wait a minute, sorry.
Correct order for removal.
PPE removal, oh yeah. You're gonna take off your gloves first and your mask last. Wait a minute, I'm sorry. I'm thinking about too many things. No, it's the first one. Gown, gloves.
Okay.
I'm looking at this, wondering about this question.
Well, it looks like 63% of you went with selection A and 30% with selection B. So then how about?
That's if you take the gown and the gloves off at the same time. Okay. Yeah, for the other example, it would have been gloves first and mask last. You're absolutely correct. So this is based on one of the scenarios. They gave 2 scenarios for PPE removal. So for most people are going to be taking off their gloves first and probably in their mask last. If you have the right fit and you're really great at taking off that gown and gloves at the same time, that means that you have to have a gown that will break easily and you pull it off on the front. It does go over that technique on those posters. So that's what threw me there for a minute. I hope that helps clarify.
Thanks, Patty. And second poll, if we could pull that one up. When is it most important to wear an N95 respirator mask? And if the responses could be pulled up when they all come in.
Yeah, that's interesting because in the first earlier in the slides, they actually mentioned, and I should have pointed it out, that it was an aerosol generating procedure. And when collecting a COVID-19 sample, that's on that chart, one of the first slides. However, I actually agree with A and C. I would do it for A, C, and D, actually. It depends on where you're if you're collecting in a facility where people are going to be coughing and gagging on you, that you probably want to be wearing all that. When you're transferring a COVID-19 positive resident, they are going to be wearing a mask if they can. they say wear a mask, or they should be at the minimum, because there are patients that cannot wear a mask, cover their face with tissue or some kind of barrier so they can still breathe. So that is a tricky question, I think. I think it's very hard to pick two there. But I know that I think Martha's intent was C and D. But like I said, myself and one of my NP colleagues, we picked A and C.
And Dr. Nakashima, it looked like you unmuted yourself. Did you want to weigh in?
Yeah, I think one of the things that you have to consider when you're working with COVID patients is the what you're doing with them. So if you're going in and just giving them medication, that's very different than going in and spending a long period of time giving them physical therapy or giving them a bath or changing their diaper, something like that. So I think there's some ambiguity there. I think most of the time, but early in the outbreak, for example, we didn't have enough N95s to have everybody fit tested in our COVID-only facilities. So we they just used regular surgical masks for caring for those patients. And I think that we didn't have any infections. I mean, we had healthcare workers in all the time that we've had these COVID-only facilities, we only documented 2 conversions in our healthcare workers that we thought might have been due to working with COVID-positive patients in our COVID-only facilities. But one of those, the employee had been sanctioned numerous times by their supervisor for not wearing PPE properly, and the other person had significant exposures outside the facility, so she may have gotten it outside the facility. So I think that some of this is you have to kind of think through what you're trying to do here. So for example, they didn't talk in this lecture, we didn't talk about source control versus inhalation control. Okay, so if you are a COVID positive person, you're putting out aerosol generating infected droplets, very small droplets whenever you speak, whether you cough or not. I mean, there are droplet particles being generated. So that person needs to be covered with a surgical mask. And it can be a surgical mask. N95 isn't necessary for that. A regular mask that's a surgical mask is fine for doing that. And I think the time that you want an N95 is when there may be somebody that you're working with that's infected that is unmasked. So that's why we talked about with the patients that you might be bathing or whatever. I would try to put a mask on even then while you're in close contact with those persons. But the N95 there is intended to prevent the healthcare worker from inhaling the virus. So I think that thinking through why you're using the PPE is pretty important.
Thank you very much, Dr. Nakashima. I think we're nearing the end. If we can go to the next slide yeah. So just to let you know, a couple of upcoming things, resources for assisted living homes and other facilities. Those of you who might be interested in using the National Healthcare Safety Network for any tracking and surveillance, we're going to be doing a session next week on August 25th, and additional follow-up sessions, and we invite you to be part of that. And Lisa Barton is our technical expert on NHSN for Comagin, and she can be reached out to for assistance or for further information on this. We're going to be sending out an invite for next week to folks. Those of you who are here for the first time, I invited you to please put your name and email into chat. We are doing this assisted living and intermediate care focused infection prevention series on a weekly basis, Wednesdays at noon. I'd be glad to send you the recordings and slides and resources of what we've done so far to get you caught up and get you on board for our remaining sessions. We'd love to have you. So our next session actually is going to be next week at our regular time at noon. Also wanted to point out a couple of you over the course of our sessions have been sharing that, you know, just the burden and the impact, emotional toll that this has been taking on workers, COVID-19, all the preparations, the, you know, heightened vigilance that we've had to have on this extended period of time. So we've been doing these little hot topics series, and we just had done one recently on healthcare worker wellness, and that link that's on the slide would allow you to access this two-part really great event that we had in June and July. We also do have quality improvement technical assistance and a serious illness conversation guide conversation, and that's definitely something to think of in your overall pandemic response, because we are having, you know, some of our residents unfortunately lose their battle with COVID, and so these end-of-life conversations are very important to have with the people who know them the best. So Adrienne Butterwick is our contact at Comagine for those resources. And if we can go to the next slide, I think that might be, so we are at the question part, and I'm going to just quickly ask, we heard from Dr. Nakashima, and since we've got Christy Grimes also on the line, we did have a question just about supplies, emergency supplies, and also our other question in chat came around about fit testing. So I didn't know if Christy or Alan, if there were, Dr. Nakashima, if there were any resources that we can share with folks on the line for either replenishing supplies or fit testing.
So, Christy, you can add to this if you want to, but the table that was presented on the local health department contacts for the supplies that we get from the national stockpile, et cetera, all of those are distributed to local health departments from the Department of Health into those contacts. So that's a very important resource for you to go to. So if you need supplies, that would be a place to start. The other thing is when we have a COVID event in a facility, we provide extra help with that. We're going to have a session on responding to an outbreak later on, but the part of that response is for us to help you get ready for taking care of COVID positive patients rather, and providing you with the best access of what we have to PPE. We often do have shortages statewide. I mean, this has been ongoing since the beginning of the epidemic, and but we tried our best there with facilities that are undergoing a COVID positive event to provide them with the best PPE we have available and training for their staff on doing the proper donning and doffing and setting up on the donning and doffing station. So, you know, so that's another important resource is to call us if you're having a COVID event. And I think the other thing to keep in mind is that, you know, you need to keep up with the literature. It's hard. You know, I think it's, you know, as Patty was saying that, you know, she's reading up constantly. Well, all of us have to do that. And we are constantly updating our website as well, because a lot of things come out. So, for example, over the weekend, we had this study that came out about gators. So gators are these, in Utah, you know, we do a lot of skiing. So they are the elastic or kind of elastic fabric covers for your face when you're skiing. And so some people are using those as their face cover when they're going to a store or something like that. Well, so for example, that probably isn't very effective. You know, that's a stretchy fabric. It's one layer. And when you stretch it out, obviously the little spaces between the threads get bigger, and so the aerosols can go through there pretty easily. Masks and masks are not the same. I think people need to look at the masks they might purchase, especially reusable cloth masks. Should be 3 layers at least. Tightly woven cotton is best. So everything isn't the same. Surgical masks are better than any cloth mask. That's been looked at. But I think it is kind of difficult, all of this. But I think in some respects, you do need to keep up. And again, on our website, we try to update you on these things. Christy, you have anything to add to that?
Thanks, Dr. Nakashima. I do not. We're referring people to their local health districts for those PPE supplies. I do know that some facilities are having better luck with some of their food vendors, especially with gloves. The question about fit testing, yes, fit testing is different for each N95, and so it is difficult when you're not able to get the same brand of mask time after time. We're struggling with that with surveyors as well, but yes, each individual brand would fit different. So it's ideal if you could get fit testing each time you're changing with a different brand. We understand that that's difficult, and reality is what it is. But yes, they do fit differently. And there was a question about eye protection and should that be used at all times? Yes, universal precautions have changed with COVID, and universal precautions, regardless of your COVID status in the building, are mask, eye protection, and gloves. Those are your basic universal precautions, should be used at all times.
Okay, thank you both to Christy and to Dr. Nakashima. We're at the top of the hour, so I just want to tie this up by saying, again, there's those of you who had put some questions and comments into chat. It looked like they were responded to. We will be able to share the recording, the slides from today, and also some of the resources that we discussed, including somebody commented about having their residents let them know when they're seeing staff maybe not upholding good practices with infection prevention. And it reminded me of something one of our Washington partners shared, so that's something that we can include in our email out to you. So I want to respect your time and let you get back to your day, and say thank you very much to Patty, who was our presenter today and did a great job. And thank you to Ali for having us at the Utah Healthcare Association event. We're grateful to you, and to Christy and Dr. Nakashima as well for joining us today. We hope to see you next week at our normal time of noon, and an invitation will be going out later this week. So thank you so much for joining us today. This concludes our webinar. Thank you, and we'll see you next week.